So what is the impact of pressure ulcers on your residents? If your resident develops a pressure ulcer, the impact may be huge. They cause awful pain and discomfort. There is an increased risk of infection. Residents often become depressed because, as you know, if one of your residents develop a pressure ulcer, they often have to go on bed rest, and bed rest means being confined to their room for numerous hours, only seeing carers and relatives occasionally throughout the day. This leads to loneliness caused by long hours of isolation. The odour that often accompanies pressure ulcers can add to low mood and depression, cause embarrassment and reduce self-esteem. The relatives also find this very difficult to deal with, as again carers do. So now let's hear from someone who had a pressure ulcer.
The wife spotted it. I said, "Oh, put me in the powder, it'll be all right." Oh dear, bless you, I wish I never had said anything like that. Anyway, the wife got in touch with district nurse. She came, got me on the bed, had a look. They took a photograph of it and they showed it me. It made me sick. Horrible. It was terrible. Honest to God, I don't wish that to anybody. They operated on me to clean it. And when I was there 9 weeks, and then I came home for 2 weeks, district nurse was to come, clean it, and put dressing on. If I was very, very pain looking at it, I think I'd have died. I would honestly.
You was really poorly when you first got your
Oh,
pressure
very
ulcer.
poorly. Very, very. Sorry. Yes, I was very, very poorly looking at it. I was. It upsets me every time I think about it. It really does. If I tell wife, it upsets her, but I don't say it to her.
Do you think if you'd have been told before that you was vulnerable to pressure ulcers, would it have made any difference?
Oh, it would have made some difference. I'd have asked wife to keep checking it.
What about the impact on you as a carer? If one of your residents develops pressure ulcers, it will certainly cause increased workload and demands on your time, but also seeing your residents suffering will also cause you distress. There is also a financial impact on your care home. The cost of pressure ulcer care is phenomenal. It may also be indicative of the quality of care given at your home and may damage your reputation. Let's hear from a care home manager.
My name's Hazel Pickering. I'm the registered manager of St Saviour's Care Home. We're a 40-bed residential. We've done a lot of training with tissue viability. They've come in and trained all the staff up on what to look out for. We have 2 members of staff that go to the link nurse meetings who come back and cascade back the knowledge that they have learnt and implement things. And it's always been a positive experience when we've had to call people in now, and we work alongside together, say, well, how can we resolve this? What can we do? What more can we do? We have a better understanding of equipment, what we needed, when it's time to upgrade it as well, because sometimes a ProPad cushion mattress isn't sufficient anymore and you have to go up to an air mattress. And it's working alongside them, and it's having a positive effect on the staff. They have new documents that they fill in. We work with the skin documents. They know to check on every single pressure area point. They know to elevate legs and what to look out for. And they're very vigilant, and when it comes to just this tiny little red area, they know to look at it. They know if it's blanching. They check for these things, which is very good. And it's you can do a pop quiz on them and say what you're going to check, and they can tell you. They can rattle it off from the top of the head all the way down to the heels. When you find out as a manager that one of your residents has got a serious injury caused through pressure, it's actually devastating to to hear that, and then you have to work with them to try and resolve it. We have a gentleman here who has been at the home since it reopened in 2007, and I've known him since 2008 when I came. And he is a fountain of knowledge. He's had a rough old trot. Over the last year, he's deteriorated slowly, but more so over the last few months. And as a result of that, his diet has gone downhill. And as a result of that, his skin has gone downhill. And despite the fact that we are continuing to do 2 hourly repositions, he's got air mattresses in place, he's got ProPad cushions, he's still continued to deteriorate, and he's developed a pressure ulcer. But he's a gentleman that has never ever taken pain relief. We might get him to take the odd antibiotic, but that's about it. He had an experience with a paracetamol. How many years ago, I don't know, but it had no effect on him, so he thinks that they're never going to have an effect, so he's refused to take anything. And I stood with that gentleman while he was being treated by tissue viability, and he held my hand, and my hand went blue for the amount of pain that it was in. It's had an effect on every single member of the staff. You know, when he's in so much pain, you hear him howling down the corridor, and it's just not nice to hear. It's awful. I think what the staff have taken out of all this is that they have to take these things seriously. They have to look, they have to check on areas and document what they've found and pass on when they find things, because it's nipping it in the bud early that stops it going any further.
So, to recap, the 3 main causes of pressure ulcer damage are pressure, shear and friction. Now, let's take a look at risk assessment. Risk assessment is understanding the resident's likelihood of developing a pressure ulcer. To do this, you need to understand the risk factors. Let's look at these. We've discussed the first 3, pressure, shear and friction. But we also have to consider mobility, sensory impairment, continence or moisture, level of consciousness, their posture, their cognition, previous pressure damage, age, nutrition and hydration, illness and disease. But don't feel that you've got to remember all this now. You can refer to page 8 and 9 of your booklet. On page 9 it will break these down even further. For example, mobility, ability to change and control body position. And this increases the risk of developing pressure ulcers because staying in one position increases the time that pressure is applied to that one area. When you look at this list, you will realise that the majority of your residents will have at least one, if not several, of these risk factors. Also, on the list of risk factors is illness and disease. Examples of these are on page 10 of your workbook. These are just some of the conditions that your residents may have that will contribute towards their risk of developing pressure ulcers. Okay, now we understand how a pressure ulcer develops and what the risk factors are. We also know that most of your residents will be at risk of developing pressure ulcers. So what are we going to do about it?